Everyone, one of the best things about working with my hands, and anyone who does hands-on manual therapy work, treating bodies for injuries and pain and dysfunctions, things like that, is that you see things every day that are amazing and is life-changing for people. So I had a young guy come in today, early 20s. He's 2 years of a lot of shoulder problems. One shoulder's got a slap lesion, which is the long-headed bicep. There's two bicep heads, so the biceps comes off here onto the projection of your shoulder blade to here. That's a short head, and the long head then goes into the shoulder, and it's actually a shoulder muscle as well, the bicep. And it gets a tear in it, and then it starts to pull away some of the rim of the shoulder. So when people say they've got a cartilage injury in their shoulder, it's usually a slap lesion, and it's an acronym for superior labrum anterior to posterior. It's just the direction it gets torn and things. So he's come in, he's saving up money for a surgery. He's had a lot of financial issues, so he couldn't really get much therapy done in the last year or so. And he had an impingement, so he's got a lot of impingement, both shoulders. It means that he lifts up to here, it starts to impinge, it starts to cause pain, and sort of starts to feel bone against bone. And at the side, he's usually the most impinged area for people with shoulders. He got to about there and had pain. That was on both sides as well. I already knew he had a slap lesion, so there's no point testing for how painful that is. It'll just stir him up. Slap lesions, when they're quite nasty, they'll make everything around the shoulder very tight. He was getting radiating pain down through here as well. It didn't seem to be of a neural component though. And it's just painful to sleep. He has an overhead job, so that's painful to do. Hasn't lifted his arms above his head properly in 2 years. And there was a court case related to because of the work-related injury, so that adds to like the amount of pressure in his nervous system. Because the people tend to get pretty pissed off when court cases are delayed, they keep going for too long. The insurance company doesn't pay out for a long time, so there's a lot of financial pressures there, and they're worried about what's going to happen with my shoulder. I'm not getting the treatment I need. That's what it comes down to. So okay, let's look at your function. So I looked at the function. Yeah, problem there. Okay, there's 17 muscles in the shoulder. There's going to be one or more of those muscles not doing the work. There's a bunch of them that should be doing the job when you go to lift your arm, especially around near your shoulder blade. If they're not working, then there's another group of muscles that come in and start trying to do the work, because the other ones aren't, the ones that should be doing it aren't. So, and that tends to cause a little dysfunction. So he's getting a lot of trap pain, levator scap pain, headaches in the back of his head, which he didn't link to being a shoulder issue, but it was. And yeah, I just did some functional change. That means that I made his bones move as if the muscles that should be working work. So I did that for his neck. Instantly no pain. He couldn't bloody believe it. I'm just moving one vertebra across. That's all, the glide that it should have. And then I go, okay, your shoulder blade's sticking out of the back a bit. Let's help that around. Shoulders love upward rotation. And there's 3 muscles that should be doing that job. And there's usually one of them that isn't working too well. And that was the case with him. Moved his shoulder blade around the way it should go when he lifted his arm. He couldn't believe it. Not just he couldn't believe it, his body couldn't believe it. He's going, what the hell? So did the treatment, released all the muscles that are tight, did a bit of needling, did a lot of bone therapy work, and taped it at the end using kinesio tape. So his body will get this rehab effect for the next about 5 days, as long as that tape stays on. And gave him some exercises. He couldn't believe the exercises instantly, so simple, helping him. Yeah, just amazing. It made his day. And at the end, I said, I'm very confident we can really go a long way with you here. Instantly change, and young guy as well. The bodies tend to respond a lot quicker and better. I hope that helps. When you're not in the healing world, you don't really. There's no reason why you'd understand that much about the body. After treating the way I do for a long time, you learn some access keys to the body. You turn this key and things start to work better. And shoulder injuries tend to get people down as well. It's like, no one can help me. Even injections didn't even help. The number of subacromial burst issues I've treated and got rid of the problem in 1, sometimes 2 sessions after injections have failed. There are heaps of them. But it doesn't always happen too. And when you say that I can definitely help you without treating it, without assessing it, it's like that person will come and you won't be able to help. That's just the nature. But yeah, soft tissue therapy and bone therapy is extremely useful for shoulder issues. Okay, hope you will.